Hello, everyone. Thank you so much for opening. It's another session. My name is Brian Simanima. I'm a radiography medical student studying at the Federal University of Technology, Owerri, based in Nigeria. And apart from my medical studies, I'm also a proficient freelance medical content writer. And today, I have an amazing guest speaker all the way from Norway. Hey, Dr. Ife, could you introduce
Yeah,
yourself to the audience?
yes, I can do that. First of all, I would like to say thank you, Ransom, for inviting me for this conversation. It's an honor. So my name is Aifi. I live in Norway, and currently I'm in Vienna right now. And I'm a cardiology resident working in Norway, and I love my job, and I love teaching my students, my fellows in cardiology, but also internal medicine. And I have a really huge, great passion learning ultrasound to my fellows. So that is my greatest passion, ultrasound scanning, not just the heart, but also the other different organs. So beside that, I have my own company where I have an online platform where I offer ultrasound courses, how to perform POCUS, point of care ultrasound in different organs. And I'm also a medtech innovator, so I have something under my sleeves right now. So I'm not going to say so much more, but that is what I do, and I really love being here today, Ransom.
Yeah, amazing. Thank you so much, Dr. Ife, for introducing yourself. So we have a couple of questions for you to answer for the public. You ready?
I'm ready.
All right. So if I'm looking downwards, I'm reading the questions to Dr. Ife, so that you'll be wondering what's Ransom looking downwards for. So the first question goes this way. So before I ask you that first question, what made you to go for cardiology? What was your intent, initially that made you to go into cardiology to study? So tell me.
Yeah, it's a little bit strange story, but cardiology wasn't my first specialty I would like to do, actually. It was actually at the bottom. I didn't want to become a cardiologist in the beginning. And it started on my when I started my internship. I just found out that maybe I don't think I'm going to want to be cardiologist because it's so difficult. It's so many things that I can't handle. But I met this cardiologist that he guided me through his work, and he showed what you can do as a cardiologist. And I think when I managed to get a mastering how to perform ultrasound scanning and be a good clinician, uh, I started to fall in love with cardiology, and that is the reason why I chose it. And when I first have decided to do something, then I will fulfill it. Fulfill it. So when I first decided to specialize in cardiology, then it was done.
All right. Thank you so much for sharing that, Dr. Ife. Um, so that draws me back to the first question. All right. So wait, before I ask you, what is the difference? What is the intersection between cardiology and ultrasound? Tell me.
Well, the interesting part is the ultrasound is like a useful tool in your as a clinician. So you're not going to use ultrasound as a diagnostic tool, but it will be a really important equipment to evaluate what kind of condition you are actually dealing with. If you have a patient that is really ill, or you don't know what you're doing, and you don't know how to treat this patient. So ultrasound is not only for cardiologists, and that is the reason I love this topic when you ask me about the ultrasound, because people or doctors think that ultrasound is just for cardiologists, but it's not. I mean, POCUS, point of care ultrasound, can be done by any doctor. If you're a nephrologist, you're a pulmonologist, hematologist, whomever you kind of specialty you have as a doctor, you can perform POCUS. You don't need to be a cardiologist. So my answer to that is that ultrasound is a really good supplement as in your clinic. So this is a really good approach how to diagnose, to actually know what you're dealing with, and how you can do further investigation to come closer to the to the patient's diagnosis.
I thought that it was only radiographers that work with ultrasound. I never knew that other specialties make use of ultrasound. Like a cardiologist can also use ultrasound. I thought it
Mm.
was like the major of radiographers working with ultrasound. I thought it was that.
Well, I'm not sure how it is in other countries. We're here in Norway and in Europe, I suppose, and in the States, we do have radiographs too. They can also perform ultrasound, but ultrasound is something doctors can do as well. Um, so I know a lot of emergency medicine doctors are using ultrasound also in acute settings. Uh, they are nephrologists that use the ultrasound as well, cardiologists, pulmonologists. So there are many health professionals that can use the ultrasound. And I know I actually just said that the doctors are using the ultrasound, but as you said, Ransom, radiographers, echo technician also use ultrasound, even though they're not doctors, but they can perform the ultrasound scanning. Yeah, so you have a huge range of different health professionals that can do ultrasound scanning, not just doctors or radiographs.
Wow, 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 wow. I really learned something today, and I believe that the audience really grabbed something today. So that draws me to the first question, Dr. Ife. So, how has your experience as a cardiology resident influenced your approach to innovation in healthcare? So, tell us.
Yeah, so how did it start? Well, I am. Honestly, this wasn't actually my plan to be part of the medical tech innovation, because my passion has always been to provide better patient care, and that is also one of the stories I would like to tell you why my company was founded in the beginning, because that changed my whole life actually. I have to take you back for almost 8 years ago, when I was finishing off my internship, and I was internal fellow in a small hospital in Norway. And there was actually an intern that taught me, or at least introduced me to ultrasound, to POCUS. He was really engaging. He was just intern. He not just just an intern longer. He was my inspiration, and he guided me and told me how to perform this scanning. And when he went off later, because he was doing his internship, I had to learn ultrasound scanning on my own, and that journey has been really ups and downs, really frustrating. First of all, I when I talk about this, I feel I get a lot, very emotional, because I all the memories is coming back, how I actually struggle to learn ultrasound scanning by myself, because many doctors don't have time to teach you, and they're not there to supervise you. And I didn't know where to start, and I did all the wrong things a doctor would do. And that would be that I just picked up a portable ultrasound scan machine, and then I start scanning. I started scanning without knowing anything about the machine. Why are there different ultrasound transducers? Uh, and what is the indication of using the ultrasound machine? And I tried some months to understand the use of it, and I didn't see any progression. Like I was actually having improvement. So I was really frustrated. I I almost gave up. I literally want to give up many times, many times, and I think that I know the reason that I kept going was because I promised myself that I wouldn't give up no matter what. But um, the day that but there was a day that really changed the whole thing. It changed my life, and I still remember it. It feels like it was yesterday. And I was at the intensive unit, and I had responsibility for that unit at that day with my supervisor. And then when we almost were done with our work day, a very critical ill patient was admitted to a hospital. And my colleague in the acute emergency department, he was taking care of her, doing all the workups, and he did it all correctly. And they thought that she had septic shock. So she was admitted to the intensive unit. She got some vasopressors, and because of the low blood pressure, uh, um, and they started to think, but what is wrong with her? Because she's not getting any better. Even though we're giving her antibiotics, a lot of fluids, and then vasopressors. And then he asked me, Ivy, before you go home, can you just take a look with your ultrasound? Um, and then I was like, oh my God, I have tried this for many months now, and I've failed so many times. But if this can save this patient, I would do it no matter what. So I did. So I did perform ultrasound scanning of her heart, and that was the moment when I first diagnosed my first cardiac tamponade. I really saw it, and it was like in the textbooks, like all the fluids and everything like that. And I remember I saw it, and I was like, oh my God, we have a cardiac tamponade here. So we have to call everyone right now. So I remember that because I wasn't actually really good at ultrasound scanning at that time. I ran up to my supervisor. I was like running in the stairs really quick, and I was like, "You have to see this. It is a really critical ill patient. I think this is cardiac tamponade. Can you take a look at it?" And he was like, "Oh my God, this is a huge, significant pericardial effusion. Of course, is she really bad?" I was like, yeah, she's really bad. We need to do urgent drainage of her. And then it all became a really Texas moment. It happened so fast, and I remember that was my first time I was assisting in this drainage with my supervisor. So uh, hopefully everything went well, and we saved her life. And that moment was a crucial moment for the patient, but also for me, because it meant so much to me that my ultrasound scanning actually help this patient to survive. And I was so happy for her. And I told myself, like, this is the this is the future. Like, you can see what's inside in somebody's body, not just the outside. And I remember I told my mom about this happening, and she was really happy for me. Like, oh my God, I know that you've been working so long with the ultrasound scanning, and now you made it. You actually saw this pericardial effusion, and I was like, yeah, I'm really happy. I would like to continue, but that day, I will always remember that day, and it still is in my heart. And that is what my mom said afterwards. My mom told me that, Ivy, if you have the capacity and the passion that you have for ultrasound, I want you to teach other fellows in this, so they can treat their patients better, or they can provide better patient care. And can you do that? And I was like, yeah, I'm gonna do that. So that is a promise I gave to my mom. So that is one of the reasons why I keep going. That is the reason why I want to reach out to the not not just in Norway, but the whole world, that this little portable machine can do a really huge difference. You just need to know how to use it, when to use it, and what do you do when you see something that is not normal. So that is my greatest passion, and that is the one of the reasons why I'm doing this, because my promise to my mom. And and what they don't know, my parents don't know, that is that I'm also doing this for them, because if my parents ever get sick and they have to be admitted to the hospital, I can't treat them because I'm in family with them. So I want to share my knowledge, my experiences to other people out there. So if they ever come in the hospital and you get my parents in your hand, I want you to be the best doctor. So I want to teach you all the knowledge and the experience I have learned, so you can be better, and you can be better than me. I don't care, because the most important thing is you have to lift up each other, and that is my greatest passion. And I feel really emotional when I talk about this, because my mom is my hugest she's my huge inspiration for what I'm doing. And that is the reason why my company NorVue was born. uh, it wasn't my intention to actually establish a company on my own, but I wanted actually to implement the ultrasound scanning education as part of our education as fellows in internal medicine. But the bureaucracy is not that easy, so I got turned down many times. So that is the reason why I chose to do this on my own. So that is the reason why NorVue, my company, was born, and that is my greatest passion. So I want to teach all the people, all the doctors and health professionals that have the use of ultrasound to provide better patient care. That was a really
Wow,
long story. That was a really long
wow,
story, but that is an important part of me, why I actually started with health innovation.
wow, 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 wow. Ultrasound does a whole lot of diagnosis on different types of diseases, over 3,000 plus diseases, ultrasound. And I love the fact that you're pushing forward to what you promised to your mom. And that's really amazing. But Dr. Ife, this was so emotional, really, really emotional. I really felt it. And I believe that the audience also will learn from it. So thank you so much for sharing that with us. So we have the second question to go. Are you ready?
Yes, I'm ready.
All right. Wait. Tell us that company, POCUS. What is their initiative? Tell us before we move to the second question. What is the company all about? POCUS. What is their initiative on the healthcare system?
Yeah, so POCUS is standing for Point of Care Ultrasound. So that means that you can perform the ultrasound scanning uh, in that moment you're with your patient. So you don't need to transport your big ultrasound machine from let's say from this office to another office. So you can actually perform it on the bedside. So you can do it right there, right now on the patient. So you can actually diagnose if there's any for example, if there's any pericardial effusion, is there any gallstones? Is there any hydronephrosis? So POCUS is actually not about the fine diagnostics like us cardiologists are doing, like do you have a severe mitral regurgitation or aortic stenosis, like that. It's all about can you are supposed to answer a question, yes or no. Is there any gallstones? Yes and no. Is there any sludge? Yes and no. Is there any the DVT, deep venous thrombosis? Yes and no. And if there is something, what should you do then? So this is actually an equipment that should be supplied to your clinician, so you can get you don't have to wait for ultrasound scanning performed by a radiologist. So this is something everyone can learn. So not only a cardiologist, you can be an intern fellow who can learn this. And um, this is for everyone, and it is also for general practitioner as well. I didn't mention that, but general practitioner are also doing a lot of POCUS, point of care ultrasound, at their office too. So this can actually provide better patient care, but it also can we can help each other, right, to reduce the time of waiting for further investigation. We can help each other so the hospital doesn't get all the patients referred to the emergency department just for looking for pleural effusion, for example. You can actually use the ultrasound scanning in your office at the general practitioner office, and tell them, oh, you do have some pleural effusion. And you have dyspnea, so I'm going to refer you to a drainage at the hospital. So you're actually saving time. So this is beneficial in many ways, but the most important thing is it provides better patient care, and for that matter, it also reduce time for waiting for ultrasound scanning or any other investigation, and you could also treat the patient faster.
Amazing, amazing. Wait, is the POCUS available to every country in the world, or is it only in Europe?
No, this is something that was, I think, if I'm not wrong, It started in the States in the beginning, but this is known in the whole world, the POCUS. I'm not sure how it is in other countries, but I know in Europe, in the States, and some in Asia too, do perform POCUS. So POCUS is really known in the world, and here in Scandinavia, which is Norway, Sweden, Denmark, we are we are a little bit behind from the rest of the world, and this is the reason why I encourage doctors to learn this so they can use this as a supplement as in the clinical evaluation.
Wow, 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 wow. This is ooh, man, this is amazing. Honestly, this is really amazing. So, I want to know something, right?
Mm.
This POCUS is it like a company that started in the US, or is it just like a non-profit organization like that helps people to like teach people about things related to ultrasound, or is it just a company on its own?
Yeah, I think POCUS is the name of the ultrasound type they're doing. Like they're doing the bedside ultrasound scanning. And there are many institutional academics that offer point of care ultrasound teaching. I have been searching for these organizations for when I started my journey uh, as a POCUS educator. I started to search for this. I personally attended to two sessions during my career. The one was in Great Britain, actually, and the second one was in Singapore, where I learned the point of care ultrasound. So it's not a organization that owns the POCUS. POCUS is for everyone, but there are different institutionals and academy that offers like I'm not sure what it's called, but like kind of fellowship, I would say, or internship in learning to perform point of care ultrasound. Others have their own company where they actually have online courses in different organs, how they teach the different ultrasound scanning of the organs. What I missed at that time, 8 years ago, I missed like there's a lot of informations on the internet, right? You can see on YouTube all the POCUS in heart, POCUS in lungs, POCUS in kidney, for that matter. But what I missed was like there was a lot of information there. I didn't know where to start, and what I realized afterwards when I look back is like if I knew what I know today, I would done it differently back then, 8 years ago. Then because everything what we learn at the med school is something you're going to take with you when you also doing doing your internship, your fellowship, and when you become a consultant, because you have to go back to the basic. And when we're learning a new skill, you have to learn the basics in the medicine. So, like in ultrasound, if you want to understand the ultrasound scanning, how you go, what is the machine, why have you all these different transducers, and which transducer you're going to use for the different organs, you have to go back to the basic. So you have to read what the ultrasound is and why is it different shapes and different transducers for different organs, and what I learned during my journey is like you have to look up at your anatomy book again. You can't just start scanning without knowing the anatomy, because when I teach my fellows, I start to ask them, what do you see here? What do you see here? And then they have to answer me, and then I can tell them, well, I ask them, is this normal or not? And then they get really quiet, and that is because they don't know actually what they're looking at. So if you're going to perform ultrasound scanning, whatever organ you are doing, you have to know the anatomy. You have to know what is normal and what is abnormal. And if there is any abnormal on the scanning, what do you do then? That's another question. But that is another topic we can discuss another time. But it is really important, like to have a red thread through the whole from using an ultrasound to actually know what you're doing. So that is why I made my NorVue, my company, is actually providing this. I'm actually sharing my experiences, my knowledge, by having all these red threads through the whole videos, so you can learn how to perform ultrasound scanning in the different organs. Because believe me, it was really frustrating at that time. And I still see a lot of my fellows that I'm teaching. They are bailing out because they don't actually understand the most basic part of medicine. And I'm telling them, you know what? You're never done as a doctor when you get your degree. When you get your degree, that's when it all starts. That's when you have to decide how good doctor do you want to be. Do you want to be an average one? Do you want to be a really good one, or are you going to be a top notch? So if you're going to be a good or top notch doctor, then you have to invest your time.
Absolutely, absolutely. So tell me, that draws me back. Before I ask you the second question, you said something about ultrasound related to anatomy. That's really amazing because without the ultrasound, you won't even know where the abdomen is in the body. You won't know where
Mm,
the other organs in the body is. So you need your anatomy if you want to focus on
mm,
ultrasound. Because
mm.
I tell my friends to who are studying radiography as I am, they want to major into ultrasound. I tell them that you need to get married with your anatomy. So I do agree with what you said. So and you're really doing an amazing job, Dr. Ify, and keep up with the teachings with to your fellows so that they can implement these strategies in the healthcare system to improve the healthcare system in general. So that draws me to the second question. I think you've thrown some lights on it, but could you just in a nutshell, could you just tell us the role of patient care ultrasound, in improving patient care, particularly in cardiologists. So tell me.
Yeah, I think like I can tell you some situations where I have been in. For example, sometimes I work in the emergency department where I'm the consultant there as a cardiologist, and we have had some patients that have been critical ill. For example, they have a really fast atrial fibrillation, for example, and they are deteriorating. So you have to then you have to decide what is happening with this patient. How does the hemodynamic look like? And that is when, okay, you have the blood pressure, you have the pulse, and you have the saturation and the respiratory rate. That is something that can help you, but you're just looking what is outside of the body, right? So that is what the ultrasound is so cool, and that is you can look what is happening inside of the body. Um, so I use ultrasound in these cases, for example, and then you can actually determine, oh, this patient has the atrial fibrillation is going fast, but I can still see some contractions of the left ventricle. So maybe so this is where I can decide, oh, I can give some beta blockers, right? Because there are some contractions there. If there were no contractions there and the patient has been having these symptoms for weeks, months, then I would do that, right? So the the patient history, the symptoms, the clinic, and your ultrasound finding will help to guide you. What kind of treatment can you give for this patient? And that is one example. There's many of them, but the second one was a patient was admitted to the emergency department where he had a lot of fever, high fever many times, and the rheumatologist they thought that it was because of his um, PMR. So they actually gave him a lot of cortisone and methotrexate to treat his pain in the joints and his in the pelvic and his fever because they thought it was because of that. But he, regardless how many times he went to the outpatient clinic to the rheumatologist, he got even worse. So he was admitted to the emergency department, to us, to find out what kind of, is this something else? And the patient was like, he was really diffuse. Like, he has a lot of symptoms. He had nausea, he has joint pains, but he didn't have any shortness of breath, and no chest pain. And the only thing we could think of was like, okay, maybe we can use the ultrasound, because there has to be something wrong. We have to take a look about the hemodynamics in his body. So when we took a look uh, at his heart, um, then we saw something really huge, because of the fever. He had many top levels of high fever, even though he had got cortisone and methotrexate. Then we saw this huge mitral endocarditis. So yeah, so this is just showing us that, sometimes it's really, not sometimes, but often, we really have to use some medical innovation to provide better patient care. So these two examples are just two of many examples I have been approached to, where ultrasound have really helped us, guiding us to know what we're dealing with and what we can do to help our patients.
Wow, 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 wow. So ultrasound is really very important in the healthcare system. And I think people should, diverge their minds towards that, because it helps the diagnosis a little bit easier, right? In terms of, you know, in any medical specialty, like in cardiology, in different pathology, in medicine in general, ultrasound is really helpful. Thank you so much for sharing that with us. So that draws me to the third question. So as a new generation health entrepreneur,
Hmm.
what are the things that you do not think will determine the future of health? So tell us.
Yeah, I've been thinking of that. I think, regardless how many medical innovation we can provide to this world, I think the most challenging part is to actually implement it in the hospitals, in the GP office, wherever it is. Let's take, for example, ultrasound, because that is what I'm doing. So, um, I think the challenge is to actually not convince, but to give proper information to the doctors, to health professionals, how good value ultrasound scanning can actually do. It has some disadvantages as well, but that is why we have other investigations, such as CT, MRI. So ultrasound is really beneficial as a bedside scanning, in many ways. And the As I said, the most challenging part is actually to encourage the doctors, the health professionals, to actually use this equipment. I have seen that, the reason why many doctors don't want to use is not that they don't want to use the ultrasound. I don't think it's because of that. I think it's because it's a new, ransom. It's like, in life generally, if you want to learn a new skill, what is your thought then? Your thought is like, oh no, oh my God, do I need to learn this too? Right? Um, and in the beginning, it's really uncomfortable, right? Everyone can relate to that. When you start something new, new skill, or whatever you do, it's always uncomfortable in the beginning, because you don't understand it, and you're like, why am I doing this, right? But then, if you actually invest your time in it, then you will see progression. You have to have a good coach, to guide you, because that is something I learned during my entrepreneurship, that you have to need a mentor. You have to have a mentor to guide you, to give you a piece of advice during your journey, because I missed that. But that is another topic. But that is really important too. That you also have a mentor during this whatever journey you're at in life generally too, because your mindset is everything here. So if you tell yourself in the beginning that I can't do this, then you can't. Then you won't do it. So it's really important that you tell yourself, hey, I got to learn something new today, so I take this as a challenge. I'm going to learn this, and I'm going to, regardless the ups and downs, I will come to the point that I can actually be a good ultrasound um, scanner. So um, I I think like when you that I think that's the most challenging part. You have to like shift their mindset. Like you can do this. Yeah, it's gonna be a little bit rough in the beginning, but in the long term, oh my God, you can do a huge difference. And what is best of all, it's really fun. Yeah, like when you waking up and you attending to your work, and you can do all this and you can do all this stuff at the work, and you can learn, and you have already mastered ultrasound scanning. That makes it more worth coming to your work, because you find it is very enjoyable. It's not just paperwork. It's also something you can do. Something you can do something with your hands. You can actually scan the patient, and you can actually see something, and you can actually do something about it if there's something you have to treat. So I think the most challenging part regarding health innovation, it's not about the things that we make, because there are really great people out there who's going to change this world, but it is to implement this equipment or gadget or whatever it is to the system. And the system is like, um, you have to have a good leader to shift the mind. They have to shift their mindset, like we have to step up the game to be better. If we're staying at this position we are in today, we're not getting better. We're not gonna get any results. So we have to try to get to see if this is actually going to provide better patient care. So I think what my answer to your question was really long this time, but I think the answer is that I think the most difficult part is to implement this is in a system that already exists, because we people, we love to be in the comfort zone, right? We love to do what we have done every time, but when something comes up, a new innovation, then we start questioning, do we really want this in our system? It's like the AI. AI is taking over the world right now in healthcare. Believe it or not, even you like it or not, it's going to be part of the healthcare. And that is the same thing with the ultrasound. Like, you have to change your mindset. Like, do you want the AI to own you, or do you want to own the AI? So I would love to have. I will answer the question, the last one, and pick the last one. And that is the same thing with the ultrasound scanning. You have to decide that you're going to do this because you're going to provide better patient care. Because I have been teaching my students, my fellows, too, where I actually ask them, do you know the patients that you're actually treating? That could be a mother, a father, or maybe a sibling or a dear friend to someone else. So what if that patient was one of your closest friends or member? Would you have done the same? Would you provide? Do you think you have given your best to this patient, and then they get really? I don't think people have ever asked them about it. So and they just look at me and like, yeah, I have to do better. And I tell them that I've been there too. We're all in the same on the same journey, but doctors don't talk about it, right? They think, because being a doctor is like, everyone thinks that we are flawless and we're doing everything great, but we are human beings too. We are doing our mistakes, but you can rather, um, you have to decide if those mistakes is going to define you, or are you going to learn from it to be a better one. So uh, I think overall it is about the mindset. So you need to have someone that is open to change for the better, and you have to change the people mindset so they can actually learn something new. It's going to be uncomfortable in the beginning, but in the long term, oh, you're going to enjoy it.
Yeah, absolutely. Wow, that was so intriguing. I love the last statement you made about the long term. I think that people shouldn't be looking at the short term goals. They should look at the long term goals. Because the long term goal determines your success, not the short term goals. Because the short term goals can really elapse, in a short frame. So thank you so much for sharing that with us. So that number four question, I think you've told us, the behind the scenes, your inspiration of, creating your own company, and
Hmm.
the you know the values and the determinations that you had to create that company because of your mom and others. So I want to know something. Your company, what specific solutions does it offer in the medical field? So tell us in a nutshell.
Yes, so NorVue is a online platform where we offer online courses in how to perform ultrasound scanning in different organs. So it is a POCUS program, so Point of Care Ultrasound. So we have divided these lectures in different levels. So the first level will be the new beginner, new beginner, and the next level will be the intermediate, the advanced one. So I have during this all these years, I have been creating my own way how to help mm, to help you and other health professionals how to master the ultrasound scanning in in POCUS for different organs. So I have divided it in different chapters. So the first chapter is always about who I am, and just introducing a little bit about myself. And the second one is about the physical principles of the ultrasound machine, uh, the difference of the transducers, why does it have different footprints, what which the transducer uh, uh, is which transducer are you going to use for the different organs, and so on. And then the third chapter would be about the anatomy. This is the part where I'm teaching them um, how to look for the different structures when you do the scanning, for example, for the heart. Because there are many things you are going to look at depending on which projections of the heart you're looking at. And because ultrasound might be boring in black and white, then I had done something that something I always wanted to do, is that I have drawn all the anatomical figures by myself. So you can actually compare dual comparing with the ultrasound scanning with my drawings in color. So you can see how it looks like on the drawings compared with the ultrasound scanning. So it makes it more visually more engaging, more fun to learn. And then when we're done with the anatomy part, I will also teach them how to perform the ultrasound scanning. So we're going to go through all the projections in the heart, for example. There are many different projections views, standard views of the heart. So I'm going to go through them. What kind of structure are you looking at? Where does the marker of the transducer have to point to give you the optimal view of the heart, and so on. There's so many things I'm actually going through that through the course. And the next one will be pathology, like for example, for the heart in POCUS, because there are a lot of diseases in the heart. But if we go to focus only about POCUS, then it will be: does the patient has a heart failure? Does the patient have a pericardial effusion? And do you see a dilatation of the right ventricle regarding if there's any acute pulmonary embolism, for example? So these are the topics I will be talking about in the pathology part, and then in the last part I will give a summary of the whole course. So this is an opportunity where you can do it online. So you can use your mobile, your iPhone, or your whatever cell phone you have, or iPad, or even your computer, to look at these videos wherever you are, at any time.
Wow, wow, that course sounds really interesting. I need to check it out, and I believe that other medical students should check it out, because you're gonna add it to the YouTube description below as well, so you can check out the course. And if you're interested, you can as well do the course. There's no knowledge that is a waste. So yeah, thank you so much for sharing that, Dr. Ife. So we have two more questions to go for you. So the fifth question is, you know, being a doctor and also being a teacher and an entrepreneur is a really a stressful profession, right? To do all
Mm.
together. So how do you balance, in a nutshell, how do you balance your role as a medical doctor in cardiology and also an educator and an entrepreneur in healthcare? So how do you balance those equations?
Yeah, I have always been thinking about that, how I actually managed to do that, because a lot of you're not the first one who asked me about it. So because being a doctor itself is could be a lot of hard work to do. I but you know what? I love what I'm doing. So this is a hobby for me. So that's the difference. Is it a work for you, or is it a hobby? So I think that how do I manage to do all these things all together? It's about your habits. It's about your prioritizing. You have to actually prioritize really hard. So to invest your time in what you love to do. So that means I don't actually watch that much TV, for example. I don't. I love eating a lot of food and going out of restaurants, of course. But you have to like prioritize what uh, you have only 24 hours per day, right? And well, I sleep like 6 to 7 hours per day, and the rest of it, what do you do then? Okay, then I have to go through my schedule because I have to do everything what I'm doing right now, being a doctor, doing my education as a cardiology residency right now, and then my entrepreneurship and all the stuff that's going on with that. I have to take care of my health first of all. I have to have good health to do all of these things. So, so I have to think of what I'm eating. Is it healthy? Do I healthy? Do I exercise? Yes, I do exercise 4 to 5 times during a week. Because it's really important. This is my kind of lifestyle, because then I feel really uh, fulfilled and I feel so happy after I've been exercising. It's really important to have some social relations with the good people you're with. I have really a few really close friends. I'm with them, And I learned during this year that if you're going to succeed in what you're doing, you have to cut off all the negativity in your life. And that means that, yeah, maybe there are some relationships you have to cut off. And I have done that just because to be at my level where I'm right now, and if I want to go further to the next step, then I have to cut more of those negativity in my life. I have to make better prioritizing in my life. Um, and that means that means I can't watch so much TV anymore because I have to invest my time to do what I love to do. Maybe I can't. Uh, Maybe I have to start reading more books, and then where in my schedule do I do where is where I do nothing. I'm actually wasting my time. So you have to, so what I've been doing the couple of months lately is like I'm writing down my diary book, what I'm doing every day, and then I'm writing, oh, what did I do in this hour here? I was just listening. I was actually doing nothing. I was like just um, watching TV, right? And I was like, this hour I could have done so much in this hour. I could finish off with one of my ultrasound courses, right? So you have to prioritize your time to manage to do all the things you want to do in life. So for me, that means that I want to be at the level I'm here right now, uh, I have I'm really happy with my health. I'm really fortunate to have good health. That means I have to exercise. I have to eat healthy food. I can eat some candies, candies, but I don't usually do that. It's really seldom I do that. I do get some cravings after 3 months, and then I really eat a lot of candies. But after my cravings are done, then I'm really done. Then I go back to my routine, and I and you have to be surrounded by positive people around you that they really rooting for you, and they actually encouraging you to do what you love. Because if you because the five people that you're going to be surrounded with, they are going to have an impact on you, whether you like it or not. So if they right now I am surrounded by really amazing friends of mine. They're really inspiring me to learn new things. Like I never imagined I would do that. And they also uplifting. We're actually encouraging each other, inspiring each other, and that is for me really important because if you are with some other friends that are negative in what you're doing, they are always complaining about their job, they're always complaining about their life, then you eventually you will also be that complaining person in the long term. You don't see it right then, but it's going to have impact on you. And I can tell you from my own experience when from my former job where I didn't have I wasn't happy with myself. And I told myself, this has nothing to do with me. Like this is like the environment in this room. This it is not really good. They're always complaining. They don't have something. It is not always something nice they have to say, and the social around them, like they're not talking with you. They are everybody's focused about just doing the job and not talking with each other. It's really important to have interactions with the people around you, because I love talking. I love talking, be social, and learn to know who they really are in the job, not just uh, this is Dr. Ivy, but who you see now, this is me. This is how I am in real life too, and this is how I am when I'm working as a doctor. And I really miss that when people are so professional I don't see who they really are. I don't get the human connection with them. And I told myself like I can handle this. I'm a strong woman. I can handle this. Like I can be in this environment regardless. I need to just step up my game, and it will be fine. But I realized that I wasn't doing fine. I was unhappy when I and my husband he realized that. He was like, you don't seem happy anymore. Like you're coming home, but you're not smiling anymore. You sound like it seems like you're a little bit depressed or something. And then I realized, like, you know what, the energy in that room where I used to work, it really affected me. So if you are surrounded by people that are giving you a really bad energy, like a negative energy, then you have to consider if that is someone you want to keep it in your life, because everything you do in life will have an impact uh, on you. So there was a guy who told me, like, there's a quote. It's not from me, but he said that your habits forms your character, and your character forms your destiny. So I, if you want to, so the answer to to your question, Ransom, it was really long again, but the answer of your question is like, how do I manage to do this? Yes, I managed to do all of this, my cardiology residency, the entrepreneurship, and having also a life beyond that. It's because of my determination. It's because of my prioritizing. It's because and I'm right now I'm just surrounded with good people, positive people around me, because those people, at least those five people that you are surrounded with daily, they will have an impact on you, whether you like it or not.
Absolutely, absolutely. Wow, that was value packed answer on that question, Dr. Ivy. So we have the last question for you. So before I go to the last question, you said something about environment. Environment does affect someone, you know, in terms of their mentality, in terms
Mm,
of their work, in terms of every kind of things in their life. And I do agree. I do agree because you can make you depressed if you're not feeling the energy in the place you
mm,
are. For instance, the place you worked before, it didn't make you to be you. It was
mm,
like a place that were depreciating you, your capabilities, and you never trusted yourself or the things you can offer, and you were depressed or something. But thank God now you're really doing a great job, and there's a lesson to the viewers out there. If the school you are in, the place you're in is not really giving you the good vibes, I think you should make a move, or you should make
mm,
a what is called a diversion, of
mm.
that place you are. So thank you so much for sharing that with us, Dr. Ivy. So the last question goes this way. So in a nutshell, how do you think technology is changing in medical education, especially in the context of POCUS? So tell us in a nutshell.
Yeah, I think it's going to be, all there's a lot of innovate medical health innovations right now coming up, and I think like POCUS will have a major impact. It already has a major impact on the patients, uh, and with POCUS you can actually, I have given some examples in different occasions where we actually managed to save lives. We managed to provide better care. We managed to do faster treatment because of the POCUS. Um, But it is also crucial that to remind everyone out there that even though we have all these gadgets, the equipments, it's really important that you have to be a really good doctor. Like you have to be a good clinician, uh, and then with all when you have that knowledge, that experience, then adding one of the medical innovation in your daily clinician, that will improve your the outcomes, right, for the patient, but also secondary, it makes it more fun for you. It makes it more like you want to go to the job because you love doing this, you love helping people. So uh, no, I Ransom. I think what the world we're looking at now is like is is a fast development. We've seen that AI is coming into, and I think that AI is also going to be a part of POCUS in the future. It's already starting to be that. So uh, that is a new way of learning the POCUS, because when you learn point of care ultrasound, you actually need a supervisor, a coach with you to guide you how you're going to use the ultrasound transducer, how you to obtain the different views. And this is where actually AI will come in to POCUS. So AI is actually going to help you to actually tell you you need to do this or this to obtain this view, and some of the AIs can actually tell you um, what anatomical structures you are looking at too. So there's a lot of things that is going to happen with POCUS. I'm sure of it, and I can only imagine what the future has to come with for us. But yeah,
Thank you so much, Dr. Ify. We've come to the end of the session, and I believe that the audience really grabbed something from what you just said. Thank you so much, Dr. Ify, for helping on, to come talk to the audience. And I believe that the audience really grabbed something up from this discussion. And so, thank you so much. So, what are your last word before we wrap up the session?
uh, thank you, Ransom, for inviting me. It was a real pleasure to do this. I'm sorry. What did you say on the last part? I
Last
didn't
word for
get
the
it.
audience. Yeah, the last word for the audience before we wrap up the session.
Yeah. Oh, sorry. Well, for wrap up for the session, I would say to the listeners that you have to find what makes you happy in life, regardless of. I know that I have been talking about a lot of ultrasound, but because that is my greatest passion. But I think what is most important for you is to find out what makes you happy at work. Are you happy where you are right now? And if not, do something about it. Is it because of the people that you are surrounded with? Are they giving you negative energy? Or is it because of the values on your that you're surrounded with? The people you're surrounded with, do they share the same values as you? If they don't do that, you have to reconsider. Like, do you really want to be with them or not? Um, and you also have to define what kind of goals do you have in life. Are you, because we're doctors talking right now, or a future doctor for Ransom here, um, uh, and you have to ask yourself, where do you want to be in life? Uh, do you want to become a average doctor, a good one, or a top-notch one? Because that will also determine what kind of person you're going to be. Because if you want to be an average one, then you will be just the same as everyone in this world. You you're just part of something. You're part of a huge pact, the pact here. But if you want to do something to really make a difference in life for yourself, but also for the entire world, because you love doing so, then do it, because life is so too short. And
Yeah.
do what you love, and don't don't overthink. That is something I have done all my life, overthinking. Don't overthink, don't do that, just do it. And what is most amazing thing is that when you do it, when you jump into it, it is amazing what your human brain is going to do. Like you're going to find solutions in everything you do. So don't be afraid.
Absolutely.
And if one of you ever want to reach out to me, just connect with me, or just send me a message. I would love to help you and guide you.
Absolutely. Thank you so much, Dr. Ify. We've come to the end of the session. So if you love this content, do well to subscribe, like, and comment, and share to your network as well. Thank you so much, Dr. Ify. Thank you, everyone.
Thank you, Ransom.
You're welcome.